Separating facts from the fiction that are out there. It's our KSAT Q&A, and as we always are on Thursday, we are pleased to be joined by infectious disease doctor from the Long School of Medicine at UT Health San Antonio, Dr. Ruth Berggren. Doctor, thank you for joining us. First of all, there's a note of optimism in the fact that we're seeing the hospitalization rates go down, and we're seeing some encouraging trends out there. Are you cautiously optimistic about what you're seeing?
So yes, I am, and it will only stay this way if people keep up the measures, the masking and the distancing. And I want to point out that while the hospitalization rate has been declining for a good bit now, we just barely in the last 2 days started to see the decline in the intensive care unit and a slight decline in the number of people on ventilators. So that lags behind. What this means is that the hospitals still remain severely stressed. And if you're to go onto the dashboard for the city of San Antonio COVID-19 today, you'll see the color bar indicator showing us that we are hovering between severe and critical in terms of the risk level. And that really does have to do with the fact that the hospitals are still severely stressed, even though the cases are coming down.
We continue to talk about going back to school, but that is something that continues to have so much uncertainty right now. So many questions for families, for educators. We know that the TEA has given a guideline of a timeline for a maximum of 8 weeks to delay in-person learning. But some of the superintendents we've talked to as part of our new episode of KSAT Explains that's out right now, they're asking for more flexibility on that. What is your suggestion when it comes to making that decision on when to bring kids back to class? What should we be looking at?
That's the critical question. And all of us have to, I think, remain humble and open to learning what's happening. But here's the key: data, not dates. You need to be looking at the decline in positivity, the decline in the number of cases. You need to look at the hospital stress score, and ideally, you'd like to see a community test positivity rate of no higher than 5%. That's the range. We're still at around 18% or so at this time, and we want to see that percentage of people testing positive when they go to our city test sites decline down to around 5%. That is more important than any particular date, and it could vary by community.
When we see the numbers slowly go down, and you have to balance all of the health concerns with some of the economic concerns that are out there. I know there's going to be a school town hall. I believe it is August 5th, so that's next Wednesday, that the city is going to have with a lot of experts and talk about schooling and things like that. Where do you come down on the balance between the, people's health and people being able to make a living?
Right. It's a delicate balance. And doctors like me are very attuned to the fact that schools are critical. Without schools, a lot of parents can't go to work. A lot of kids depend on schools for food, in addition to all of the things that are so critical to a child's well-being. So we really want to see schools open. We hope that we can get the community as safe as possible before that happens. And then we need public meetings like the one that's being planned for Wednesday, August 5th, for people to come together and teach each other and really understand what safety measures must look like when school does begin. But if we do it blindly, if we do it too quickly, if we do it because we're wedded to a particular date rather than safety data, we could really tip our city back into a critical situation.
As we head back to the possibility, get closer and closer to the possibility of kids being back in class, we're also moving into the fall months where you've got what's typically a busy season, if you will, for hospitals. There's flu on top of that, and then elections. We have a huge election coming up in the fall. All of these present the possibility of people getting together, people interacting more. So how are you looking at that situation? Are you even more wary as we look ahead?
I am. I'm worried. I'm worried about people who may not be able to make rent, who could be facing eviction, who have food insecurity, that could drive more people into shelters, which are congregate settings, which could be another factor that could really add to the concerns as we worry about flu and schools and elections. But let me just say this, we don't have to just let this wash over us and turn into a disaster. It really is in our hands. And if we pull together as a community and we fight the virus and not each other, we can make a big difference and we can get through this. I want people to think of the mask as their armor and the surface cleansers you're using as a bioweapon. Think of social distancing as a technique for choking off the supply chain of your enemy. And remember, the enemy is a virus, not a person. And we really need to get behind our scientists, our frontline workers, our healthcare workers, people who are doing clinical trials. They are developing the weapons of mass destruction that we need to win this war against the virus, which is the enemy. They're developing vaccines and they're developing drugs, and we're developing them in San Antonio. And community leaders, we need to support one another. Community leaders must support each other, not sue each other. We need to swallow our politics and do the right thing. Wearing masks will actually increase our freedom and our ability to get back to our American way of life.
We are not defenseless. Dr. Ruth Berggren, UT Health San Antonio, thank you so much for your time, and we'll see you on the Night Beat tonight.
Thank you.
We'll be right back.